I hope that you are ready to relax, to enjoy, to reunite with people that you may not have seen for several years. And we plan to have a very good time on today. We want to celebrate festively the health department for 60 years of providing service. I would dare to say that there are not many businesses that are around that would be able to say that they have been going on continuously providing service, high quality service for that length of time. And we are just so grateful to still be here in the South Suburban area. We are so grateful to be able to still provide services to our residents. I am going to, for just a moment, have some of our health department staff to stand just for a minute so that you can recognize who some of our nurses are and some of our aides at the time. Park Forest Health Department staff, can you stand for a moment? Raise your hand if you're all standing. People may not recognize you. Okay, thank you so much. Mayor Ostenberg is here with us today, the mayor of Park Forest, and he is going to give a resolution for the health department on today. So please welcome Mayor John Ostenberg.
Let me just say before I read this proclamation how happy I am to be here today. The Park Forest Health Department is unique in terms of the services that it offers to not only the residents of the village of Park Forest, but to a number of our neighboring communities. There aren't many communities around that can brag about having a full-service health department the way we can, and we are extremely proud of that. A few years ago, you know, the board had to look at some of the things that were going on in the village, and we had to do a reassessment. And you know, there was some concerns that the health department could have gone away at that time. And I have to say, Chris Blue, I always say this, boy, she took the challenge and she just put the department back in shape and headed it in the right direction because circumstances were changing. There were different needs. And the way that the health department redirected itself, we are just extremely proud of that. And while I think all of the former directors we're happy for the contributions that they made, I'm especially pleased to acknowledge Chris for having made the health department something that could succeed going forward, and we really appreciate it. It's been a busy day for the village board. We started at 10 o'clock this morning with a rules committee meeting and had a resident who had loads of concerns and complaints that we listened to. And then we had a new business in the downtown that opened, M&S Swag. If you like modern clothing, stop by there. It's right on the main drag in downtown Park Forest. And so we had the ribbon cutting for that. Now this event, I have yet one more thing to do. I know some of the trustees also have things to do. I want to acknowledge them before I read the proclamation. Our senior trustee, Trustee Ken Kramer. That means senior in terms of years of service, okay? I'm not saying that he's older than I am, but just years of service. Ken, in fact, has served as a trustee longer than any other individual in the history of the city. On our board and giving us that sense of history of our community. The penultimate senior trustee, meaning the one next in line, is Trustee Bonita Dillard. I saw Bob McCrae come in somewhere. Up in the corner. Okay, Trustee Georgia O'Neill had a family situation that she had to attend to this afternoon. So while she was with us this morning for those events, she couldn't be here this evening. And I also want to acknowledge our village manager, Tom Mitt, because he's the one who runs the village. Those of us who are policy policymakers. We take all the credit, but Tom does all the work, he and the staff, so we're deeply appreciative of that. One other thing I want to say is yesterday there was a wonderful, wonderful event, the Access to Care event, and Victoria Bigelow is with us today, and we're very happy to have her. Park Forest Health Department was one of the originators of Access to Care, and Access to Care really provides access for people who have no other way to get care. And health care is vital. There was a wonderful luncheon yesterday. We heard from 4 experts, plus my personal hero, Dr. Quentin Young, and they talked about some of the things that are at large in the national health situation with the Affordable Care Act and what may happen to it with decisions that will come down from the Supreme Court. But in the midst of all of that, one of the things we have to recognize is that right here in Cook County, we have an agency that's providing access for those who can't afford it, and that's Access to Care, and we hope you have many, many more years of success, Victoria. Now that I run out of things to say, I'm going to read this proclamation. And I have to take off my glasses because I don't have my reading glasses with me, so I got to hold this way up close. Whereas the Park Forest Health Department was organized in 1952, and whereas the Health Department delivers a variety of health services consistent with the changing needs of the community, and whereas the driving principle behind the Health Department is the encouragement and empowerment of individuals and groups to pursue healthy behaviors and to reject choices that produce illnesses. And whereas the department has grown, it is now organized into 6 clinical service areas: environmental health, home nursing services, child and family health, senior health, and adult health. And whereas in 2011 alone, the health department served 10,579 persons in 68 communities. And whereas the current staff of the Health Department carries on a long tradition of providing preventative care to families, adults, and children, and whereas on the occasion of the department's 60th anniversary, we salute the 7 Health Department directors: Florence Thompson, Emily Webster, Val Campbell, Nina Longley, Lois Coxworth Gallagher, Christine Blue, and the current director, Janice Irwin, and the countless number of nurses, LPNs, home health aides, administrative personnel, and volunteers who serve the department nobly. And whereas the village's founders should be commended in their foresight in seeing the need for offering health care services to a growing town and to following through on its creation. Now therefore be it proclaimed that I, John A. Austenberg, Mayor of the Village of Park Forest, do congratulate the Park Forest Health Department on its 60th anniversary, and that the department continues along the path of serving the needs of others. Proclaim this 2nd day of June 2012.
The panel that is here, they are going to have words of expression. The first person that's going to speak to us is one of our former directors, Lois Coxworth.
I was here from 1982 to 1994, and I had been here previously for 3 years as a public health nurse. I have 5 children, and I had always known I was going back to work, but I didn't realize it would take me that long. So in my 40s, I started looking for a job, and as public health looked awfully good at that time. I was used to running my own ship, and that doesn't happen in a hospital or many other places where nurses are working. But Park Forest had been a community that I had worked in with some volunteer programs, and I knew that it had a good reputation for providing services that were good and having people that really were very thoughtful. So I was hired by Val, and Val was a public health nurse without any further training. She had her RN, and that was it. But she had a very bright mind, and she was pretty spunky. And she is the person that actually got the Park Forest Health Department the first Medicare possibility from the government that we would be able to have a home health care service. So Park Forest's home health service is number one as far as age in the entire South Suburbs. And she saw in it a sort of an extension of our home visiting, and also a way to keep our budget going, because the budget has always been a big thing in Park Forest. We have lots of ideas and very little money. So we have to be very frugal in what we do and really look for liaisons with other interests, organizations, and even communities. So when I was here, Val was hoping to move the Park Forest Health Department nursing program for seniors and Medicare patients forward. And she hired, I believe, 3 nurses, though it might have been 4. And of the ones that she hired, I think 2 of us stayed. One was a new graduate whose husband was a pharmacist, and there was a nurse about my age and myself. I loved it. My family thought I'd gotten a new husband or something. I was so excited about what I was doing in the Park Forest Health Department. It was such fun to go and talk with people and get to know them. And it's true that people in Park Forest are really more active and more interested and more willing to take a look at the other side of the problem. So as time went on, I enjoyed it more and more, but I realized that I hadn't really been in school for a long time, and certainly didn't have any professional background for the public health that I was doing. So when the time was right with my family, I told Val that I was going to, I think it was Val, or maybe it was you that I told that I was going to leave and go to school. Were you in charge then?
No,
Val was still in charge. Okay, Bonnie followed Val. And I'm not going to stay on too much longer. Anyway, I did go to U of I, and I got a public health nursing master's degree, taking quite a public health at the public health, not just in nursing, but in public health, the program itself. They asked me to stay on as a member of their public health nursing program. And I was there for 3 years. I had just made professor, and I got a call from the mayor. I got a call from Park Forest that they were looking for a new program director. I went in and interviewed, and yes, it was very interesting, but I was sort of tied up because I was going in for a master's program so that I could stay on at the U of I. I started thinking, though, and it seemed to me that it made more sense to stay closer to home and actually be able to do something that at my age, going back to school and probably not finishing until it was too late to do anything. My husband agreed totally, and I came back as the director. I think I would say that the patients that you work with, the people that walk through the door and have some need, and the people that give it were spectacular. After working at a university where things were more businesslike, we didn't have the feeling that you have when you're working in a community where you know everyone, and everyone knows you and what you can do, and you know what they're able to do and what they need. That is extraordinary. The other thing that I think was the biggest thing that happened, other than celebrating our 35th anniversary, was working with Access to Care, a program that Park Forest really is sort of the odd one in it. Everybody else has a large organization and lots of money behind it to found this community trust organization that's been around over 20 years now, and it provides help for people who are working but do not have health care and are low income to go to doctors for out of hospital care. that organization has bloomed, and it's taught me a lot. It's taught, I think, Park Forest a lot, that you don't have to do everything yourself. There are people out there that are interested in what you're doing, and you can help them, and they certainly can help us. So I congratulate the village for doing this. It's a beautiful, beautiful afternoon, and it seems like everybody was noted there. And I'm going to turn it over to the next person that's going to give you their take.
Thank you.
I'm happy to have been able to serve Park Forest Health Department for 20 years. And I want to salute this community and give credit to their participation and all of the thousands of hours over these 60 years that they have given in their time and their talent so that we could produce the kind of programs that so truly serve the community. There is one correction I want to make on what Lois said, and that is that it was really Emily Webster who started the Medicare, and we got Medicare and Medicaid while she was the director. And it was a wonderful organization, and you know that Dr. Alice Reacher and Dr. Manny Reacher were really instrumental in keeping us afloat many times. They were our advocates, and they volunteered time, and they were just great. So I am so glad to see all of you here today, and I want to thank you for being the wonderful community that you are.
Thank you.
He had a great job in the, from 89 until 93. I was an administrator in a healthcare unit at Stateville Correctional Center. One day my neighbor leaned over the fence and said, Lois Cogsworth is leaving. You ought to apply for the job. And I said, well, I've got a great job right now. And you got to apply for the job. So I sent a letter of interest in. And 6 months later, I was offered the position and decided to take it. It was probably the best decision I ever made in my life. Bonnie, when we were chatting before, and I'm going to credit you for saying this, said that everything that the directors and the staff have been able to do over the years, over 60 years, is based on people that preceded them. So from Florence all the way through Janice, we take credit a lot of times, and we're the people with the faces on the pictures a lot of times, but all the staff, hundreds and hundreds of staff members and volunteers. And I'm grateful I listened to my neighbor Jerry Kinder and took the job, and it has been, for me, a life-changing event. The mayor before mentioned the troubles, but it was a real challenge and a character builder. Things that, and thank you for not giving up on me, and the board also. I think that the health department is unique. It needs to be supported. It needs to be bolstered. It needs to be used. It needs to be praised. All the nurses, all the staff, the support staff, Marcia with her computer skills and Brenda with her charm, besides the clinicians, the office staff, they all need to be recognized for the wonderful job they do on our behalf. On our behalf. And you never know when you're going to need the health department. One quick story. I never knew much about the health department until my second son was born in 1970. I lived on Ash Street, and I got a phone call. The health department would like to come and see your baby. And I thought, oh my God, what did I do? And the most beautiful nurse came knocking on my door the next day. Her name was Charlotte Bollmeyer, and hugged my baby and felt my baby and looked at my baby. And too bad he's not here. He would be so embarrassed today right now from seeing him. Weighed him. and gave me the encouragement, you know, and he was my second child. It's not like it was a mystery or anything, but really gave me, you know, this opportunity to brag about this child and to share with a professional person. And she is one of the reasons, her kindness, that I decided to go on and be a nurse after that. So, bless her heart.
It's thrilling to be here because Manny and I moved to Park Forest in the early 50s. Anybody here go back that far? Oh, I do. There's a few people there. It's a long time, isn't it? And we remember the growth and development of the health department and what joy we took in seeing it happen. And my advice to all communities is if you have your choice between a few wealthy doctors that might live nearby or in the village or some dedicated nurses, pick the nurses every time. We did. It's been wonderful, and I'm very proud of this organization and of having raised my kids here. And they're so proud to be Park Foresters. They live all over the country now. I can't think of anything else except how much my husband would love to be here. He was very devoted to the growth of this group. And I wish you were here too, Manny.
Thank you so much.
Chris, you took my story away before I got to it. Because when Janice asked if I would talk about being a part of the professional advisory board, I thought that really isn't what the big joy for me was. Having moved here in 66, I believe, or 67, with one child from Baltimore, you know, the first child, I was there, my parents, a whole family, so it's very different than when you move and then you have a child and that family piece isn't there. So like Chris, I got a phone call asking if they could come and visit with me and my baby. And being such a newbie to this community, I thought, okay, are they trying to see if I'm taking good care of my baby, or if I can't do this by myself, or just what? And it was really, truly a delight to have the nurse come and sit and talk and check my baby out, Michael, who doesn't live far away. And like, I think he would be a little embarrassed at telling about this, but it was really a great support, great comfort. He did have a few little issues, and to have someone to talk about them and to give me some advice and to feel that if I needed that, I knew where to go. So that was my first introduction to Park Forest Health Department, and it will always be a lasting one, because I think that was just the right thing to do for new moms. Even if you already had another child, it really didn't matter. It was really great. Having been here, coming here, I didn't start out doing what I'm doing now. I'm not talking about the trustee part. I didn't start out doing that either. But I started out doing volunteer work in the schools with my children. I went to school as an adult, and people were encouraging me to go into education because I spent so much time in the schools. And I thought, no, one teacher in the household is enough. What I did end up, after doing a lot of exploration, choosing to do was to get a degree in occupational therapy, which is a related health field. And that has been, I really think my experiences from being here as a resident of Park Forest helping me choose a direction in my life. And once I had finished school, and I don't remember who asked me, told me about the Professional Advisory Board of the Health Department, and I thought, oh, well, that sounds like a neat thing to do. I had done home health as an occupational therapist and was still doing a little bit of it. And Lois was the director at the time that I was on the Professional Advisory Board. And what we did, there was the doctor and sometimes the physical therapist and the nursing, and we would review charts of patients that had been seen. So what we were looking for was quality of care, and helped come up with some of those monitors that would be needed to kind of measure just how good of a job was the health department doing in terms of taking care of the patients of our residents, and how the residents felt about that care. So I really valued that. It was really a nice adjunct to my career as an occupational therapist. I got a little bit too involved to continue doing that, and was much more involved in my association. But coming back after being appointed to the board as a trustee and then being elected, there was this little piece about being a liaison to the health department. So I asked Mayor Ostenberg if that was a role that I could play. And so I have served as the liaison from the Board of Trustees to the Health Department, and it's really a joy. You know, I feel very proud of having grown and developed in this community because I was young when we first moved here. So this has been my life, and I am so proud of the community and all that has gone and all that it's done. But two things I've always told people about. One is our public library, that's a gem that many people don't recognize. But that is that we are the only village in the South Suburbs that has its own health department. And it is such a great joy. I really am very thankful to all of those that have come before, all of you that are here, and all the staff that continues to help serve to keep Park Forest residents as healthy as possibly can be, so that we have always known as being a community that takes care of its residents in many different ways, but particularly in health. So thank you to all of you that are here. Thank you to Janice and all of those who have helped to keep the health department being just what it is, one of the biggest gems, not just in Park Forest, but in the South Suburbs.
We want to take just a moment to recognize also our colleagues that have passed away, that are not with us any longer. As I call out the names of those that have passed on, I'd like to ask for one volunteer to come and light one of the candles here in their honor. The first person was our first director, right here. And they're on the table right ahead. The first person was our first director for the health department, Florence Thompson. Thank you. Our second director for the health department, Emily Webster. Thank you. Our third director for the health department, Val Campbell, Gloria Reed. Another one of our nurses that was very dear to our heart, Helen Peel. Kathy Watson. Dr. Emmanuel Racher. Norm Dublin is one of our health inspectors. Mrs. Rhoda Adler. Rose Carol Brown. And Florence Cunningham. Okay, thank you. Let's just have just a moment of silence for them, just a moment. Now, I also wanted to recognize two of our sponsors that were very, very supportive of us putting together this event on today. Vitas Innovative Hospice. That's raising their hand. They actually supplied all of the food for today's event. So thank you so much.
And Kathy Carlson,
And Kathy.
our clinical
You want to both stand for
nurses
just a moment?
manager.
Is it who you want? All right, thank you so much. And then also, when we decided to do this, we went out into the community, into the neighborhood, and sought some support for the health department. As we were celebrating, we also wanted to market a little and do a little fundraising. And as we went out, we were able to gain 37 sponsors that sponsored and put an ad in our ad book. So we are so grateful for all of the businesses, all of the individuals, everyone that it touched our hearts that they were supporting the services of the health department and that they gave from their hearts. And we thank you so much for that, each and every person. Out of all of those sponsors, our gold sponsor, our single gold sponsor was Lifetime Automotive Business of Park Forest, and they're located on Western, and they gave $1,000. To have a recognition for our health department volunteers for all of the years that we have provided services under each and every director that is here. We never would have made it had it not been for our volunteers.
And I've been around Park Forest for an awful long time. Try 1964. It makes me sound a little bit old. I am. I'm a great fan of the Park Forest Health Department. They have been wonderful to me, and I'd like to share a few happy memories I've had. It's going to be brief. My fondest memory of Park Forest Health Department is the many wonderful people I've met there. I volunteered. I've also been a patient twice, and that's something. Volunteering was a lot of fun, and the staff helped to make it so. I registered people for immunizations. I helped with school physicals, and I also worked the men and women's clinics. It was there, and this makes me sound very old, I had my first experience with a dipstick. Maybe in all my years of being a nurse, I had never been exposed to one. All through the time of volunteering, I really, really enjoyed doing it. As a patient, I experienced wonderful care. After 2 long sessions, I came out alive. RNs, physical therapists, and the whole staff made me feel secure, and they all went out of their way to be helpful to me. I particularly enjoy, and he's not here today, my therapist, Gary. He used to always say he enjoyed doing my therapy, and I never quite knew whether I should believe him or not, but I enjoyed him. I have 2 RNs that I particularly would like to name, and I know you can't name everybody, but Sherry, who's here today, and my lifesavers. They were excellent. I can't really remember one incident that especially occurs to me because everything was always special. And I always remember and recommend the Park Forest Health Department. Congratulations on your anniversary. Cheers to you all.